In this module, we're going to focus on customer satisfaction, and essentially our patients in our healthcare facilities are our customers. We're going to talk about the different ways we can survey them and how that ties into our reimbursement structure in particular for healthcare organizations and for our facilities in particular. So you've probably seen this image before. Have you seen two faces looking at each other or a vase? It all depends on your perspective or your perception. But the reality is that people often view things differently. So to our customers or our patients, think about it from a healthcare perspective and from that patient perspective. Do they really want to be there? Generally patients who are ultimately your customers don't want to be your customers, which often creates a service challenge immediately as soon as they step into our facilities for us as healthcare providers and healthcare administrators. Patients are going to see things differently than clinicians. As clinicians and administrators, we often see the rules and regulations that are tied to patient care, the different protocols and procedures that we have to go through. And patients don't necessarily know or care to know that information. All they care about is getting in and out as quickly as possible and recovering and having as good of an experience as you can have in the hospital as possible. So just a couple things to think about. Not everybody's going to see things the same way, and we need to really put ourselves in the patient's shoes and think about what the patient is experiencing. So our payer sources, things like Medicare, Medicaid, TRICARE, private insurance, they're going to look at publicly reported customer satisfaction data. And they're going to use that to make decisions on payment to your facilities. So one thing I want you to do, and I think I mentioned this later on through the module, I want you to get on a website called Hospital Compare. You can jump on Google and Google Hospital Compare, and you can actually go on and compare the customer service data that's been reported for any facility in the country that accepts Medicare or Medicaid payments. And it's important to know what are your customers experiencing and what is their feedback getting to you as an administrator, because your reimbursement as a facility is now tied to patient satisfaction scores. So this is really a list that's thought to be inclusive of patient-centered care. You have your 8 dimensions of patient-centered care, or PCC as it's sometimes called. And the questions that you're going to see on any type of surveys that go out to patients are often going to revolve around these particular areas. So there's 3 different survey types. I'll go ahead and put them all here. There's 3 different survey types that we can use to survey our patients. The first one being the patient satisfaction. This one is highly subjective. This is where you go through and rate on a scale from excellent to poor. The downside to this one is not everyone's going to view services in the same light, especially when you have a generational gap. So you may have older generations that think nobody is able to achieve excellence, and that good and very good is probably the highest that you can get. Counter that to how a healthcare facility looks at it. They have the initiative to strive for excellence. So if you have a patient going through and giving you good, very good, when you really should be getting excellence, that really can hurt your patient satisfaction scores and ultimately your reimbursement. Now we move to the next, patient ratings. Now this is quantitative. You can tie a number to it, and this is where you use a scale from 1 to 10. But again, just like the patient satisfaction surveys, many people may not think 10 is possible. And again, perception is everything. So different people are going to view things differently. You may have 10 patients total. 9 of them score you a 10 on every area and every category on that survey. Then you may have that one patient who was really upset by something that happened in the hospital, and they're going to give you 1s all the way down. Whether the service was good or not, let's say they had a good experience with your dietary department, but because of something that happened with the lab, let's say, they're going to give you 1s all the way down. And it's going to work against you because it'll drop your average overall. We're usually striving for 90% or higher because Medicare is going to use this to tie your reimbursement back in. So again, perception is reality, and everybody's going to view things differently. Now, the one that we are going to see used probably most often and is the most objective is your patient experience. So this is where we use a scale of never, sometimes, usually, and always. Again, Medicare here is going to use this particular rating scale in their HCAHPS survey. And patients will rate you on they never experienced a delay in care, they always experience a delay in care. So there is a little subjectivity left in there, but they try to take that out as much as possible. So we look at qualitative or quantitative, both different types of modalities to survey patients. Qualitative, you know, you're going to get a lot of feel-good stories here, but you're not going to be able to quantify them in any term, in any way to put them in some type of report. So usually the quantitative modality is going to be the ruler because you can pull that quantitative data out and put it in some type of report to show patient satisfaction. But these are just two different ways of getting feedback, not only from your patients, but you can use these forms for your staff and your employees as well. Now, Press Ganey, this is one of the third-party commercial surveying firms out there, but it's one that you will definitely become familiar with if you're not already. And if you're not familiar with it, I've linked up here on the slide to the Press Ganey website. I would suggest that you go to Now, your CAHPS or your HCAHPS survey is going to be your standardized Medicare survey. And I've linked up here on the right-hand side the website for Hospital Compare that we talked about towards the beginning of this module. You can go to the site, put in the zip code for the area that you're in, and you can compare up to 3 hospitals side by side. So I really want to encourage you to go out and look at this site. Especially if you find yourself in an administrative role, you're going to become intimately familiar with this site. So I want you to go out, just type in the zip code for where you're located, compare a couple hospitals, and really pay attention to that patient experience tab. Now you can take the information it gives you and put it in graph form, which may be easier to see and compare side by side, but go out to Hospital Compare and compare a couple facilities around you. You may be surprised. Now, the last value that's not necessarily listed here on this slide, but is a huge value of the HCAHPS or the CAHPS survey. Hospitals are now being incentivized on patient satisfaction scores. So patient satisfaction is becoming a huge deal within healthcare and the value-based care that we give to our patients. I'm going to end here with the lecture. If you guys have any questions, please let me know.